Hello, my name is Sebastian from the kinesiology program, University of Guelph. How are you today?
I'm good, how are you?
Not bad. So today we'll be testing for external hip rotator strength through a manual technique. This will provide you with an idea of neuromuscular recruitment as well as how your muscles are able to function through movement and as well as provide stability. So to begin testing for external hip rotators, we're going to have the client sitting up at 90 degrees hips and 90 degrees knees, as you see my client doing right here. Next, I will instruct the client to relax your body, so please relax your body, after which I will place the thigh facing externally because we're testing for external hip rotators. I will place my right hand on the lateral side of the knee, applying force medially, and my left hand on the medial side of the lower foot, applying force externally. I will hold it for you'll try to hold it for 4 seconds while I ramp up the force. So relax your body, and we're going to go. 1, 2, 3, 4, and relax. Perfect. We're going to try the other foot now. So placing the thigh again, facing externally, applying force immediately through the knee, externally through the foot. So relax your body. I'm going to try for 4 seconds one more time. Ready? And go. 1, 2, 3, 4. Perfect. And relax. So a score of 5 means there was maximum hold. A score of 4 means that there was moderate hold or give. A score of 3 means that there was movement through the ROM. And a score of 2 or 1 means that we have to redo the test, but supine. Our client here had a score of 5 because she had maximum hold on both legs.
So what were the muscles involved in that movement?
So some common muscles involved in externally rotating the hips are the piriformis, the psoas minor and major, and the serratorius, as well as all the glutes, all the glute muscles.
And what are common movements that involve these muscles?
Some common movements involving these muscles. So the most common movements are probably stepping sideways, or movements such as getting into a car. So our next test will be your gait analysis. This is a dynamic movement test used to determine changes in your base of support throughout your everyday walk. It will also allow us to determine abnormal movements, which are signs of muscle imbalances as well as corrective strategies. Seems like an appropriate running shoe for the gait analysis. No wear and tear on the bottom soles, as well as the inside. There's a sole and there's no wear and tear. Please walk back and forth normally as you would do on a normal day-to-day basis. The anterior and posterior views of the gait portray a normal head position with no lateral flexion. Shoulder position seems to be normal without any elevation to the right or to the left. There is little to no hip movements, no lateral rotation, and no hip hike. She does seem to be walking in a straight line. The foot placement is symmetric. There's no deviation from the midline. And the heel strikes and the toe off seem to be of normal gait pattern. There also seems to be a little bit of a valgus knee, which is normal for the pelvic shape of females. The side view of the gait pattern shows a normal head position without any protraction or retraction in the cervical spine or the head itself. The spine portrays a little bit of kyphosis in the lumbar area, but nothing too abnormal and nothing to raise concern about. This client seems to have no arm swing in her normal gait. The stride length is a little bit on the longer side, but still normal. There is little to no hip movement with no pelvic rotations to the right or the left, so the hips are level. There is proper knee extension, and the heel strikes and the toe off seem to be of normal gait pattern. So do you have any questions or concerns about any of today's tests?
No, thank you so much for administering them.
No problem.